Hello, this is the theory portion of the skin, hair, and nails assessment. We will be doing hands-on practice and instruction in class, but this presentation will contain important information regarding hair, skin, and nail abnormals that of course you're going to need to know as a nurse. Pay attention, take notes, and participate when you are prompted. The lesson objectives should be used to guide you in your learning through reading. We are going to demonstrate the use of examination methods of inspection and palpation as it relates to the skin, hair, and nails assessment, and we'll do that in class. You're going to demonstrate the nursing process in providing culturally competent and caring interventions across the lifespan during physical assessment of skin, hair, and nails. There is a lot of important information on, especially on lifespan with the elderly within this presentation. And you're also going to identify normal versus abnormal assessment findings of the skin, hair, and nails. So again, use these objectives to guide you in your reading as well as throughout this presentation. Assessment methods that you're going to use for the assessment of the skin, hair, and nails will be interviewing the patient. Remember old carts. If you don't remember it, take a minute to look that up now because you are going to be using it, especially for your checkoff. When you demonstrate physical assessment to me. You're going to use inspection and palpation. We're going to start talking about the skin, particularly risk for skin breakdown, because that's really what we're concerned about. The skin can tell us a lot about our general health, but you want to be aware as future nurses that the elderly population is most vulnerable for skin breakdown. That's important because it puts them at risk for horrible infections. And you have to keep in mind that the elderly are less likely to heal as quickly. So this can be a real problem when you're taking care of the elderly. With age, there are naturally occurring changes in the skin. The skin starts to thin. It becomes more fragile. It tears very easily. Also with the elderly, there's an issue with polypharmacy, which means that they are many times on a lot of different medications that can impact skin integrity. Sometimes they're unsteady. Gait refers to their posture and their balance. So if they're unsteady, they could fall frequently, putting them at risk for skin integrity issues, of course, open areas, and also bumping into things. Dementia, confusion also puts them at risk for skin breakdown. Poor nutritional status makes their skin more fragile. Bladder and bowel function refers to whether or not they're incontinent. So somebody who is in contact with feces on their skin or they're incontinent of urine will certainly be at a higher risk for skin breakdown. Skin folds, whether somebody's obese or not, the skin tends to have more crevices than it did when it was younger, so that can harbor fungal infections, moisture. Vision problems, increased risk for running into things, and disease processes. For example, diabetes is certainly puts somebody at a high risk for skin breakdown. So be aware that the elderly population is more vulnerable than the general population for skin breakdown. So this slide just shows you some of the different skin integrity issues that elderly people can face. Now, younger people can face these issues as well, but it's just more prevalent in the elderly population. So the first one shows you a venous ulcer. You can see that it's open and infected. The second one is an arterial ulcer. I can't even talk, I'm sorry. This had to do with a perfusion issue where oxygenated blood is not getting to these areas, and certainly it can cause death of the skin and sloughing. So this person could be a diabetic patient, and you can see this is gangrene. This is a pressure ulcer. This is the sacrum. And we will talk about pressure points, but that is a common area for skin breakdown and decubitus ulcers. This is somebody's elbow, again, another pressure area, shows a skin tear. And these are diabetic foot ulcers. People with diabetes have poor perfusion And when they do end up with ulcers or skin tears, they're less likely to heal as quickly as with the general population. So this is a real problem for some of these people. The Blanch test is something that can be used to assess whether or not a skin issue is turning into an ulcer, a decubitus ulcer. So what this refers to is if you see a reddened area on your patient, what you can do is take your finger very gently, press on the reddened area. Now this would not apply if it's an open area, just if it's an area of redness. And you would push a little bit for a couple seconds. It would turn white, that's the blanching. Release your finger off of the area, and if the blood flow returns, you'll see it immediately turn pink again. And that means that it's just a pressure point. It does not yet qualify as a decubitus ulcer. So what you would do then is simply turn the patient, get them off of that pressure point, and continue to assess it to make sure it's not breaking down. This video gives you an idea of what I'm talking about with the Blanch test. There's no sound. It just shows you what I'm talking about. They push your finger on it, it turns white, and then the color immediately returns. So there's still adequate perfusion for that individual. So that's the Blanch test. I'm not going to make you memorize the stages of pressure sores, but I want to show you what we're concerned about when we start to see an area of redness over a pressure point, which is depicted right here. This is a stage 1 pressure ulcer. So the way that that would be determined is by using the Blanch test. If it does not return to that red color, then it's probably the beginning of skin breakdown. And that's where you start to see the wearing down of the epidermis. Stage 2 wears further into the epidermis and down into the dermis. Not quite as deep, but it's getting there. Stage 3, all the way through the dermis and beginning to invade the subcutaneous fat. You can imagine how painful this must be. And a stage 4 goes all the way down to the bone. Okay, so that's an osteomyelitis, very, very painful, not uncommon in people with diabetes. So certainly when we start to see this reddened area, we worry about it because we certainly don't want it to end up a stage 4. Likely sites of bed sores are going to be in pressure points, areas with the most pressure. So here, the back of the head, when somebody's laying supine, which means they're laying on their back. Right here over the scapula, the elbows, certainly the sacrum and the hip area, and then back here where I can't even think, heels are. This is an example of an individual who is wheelchair bound. You can see all the pressure points here. We certainly would want to get the person up and moving, help them to change positions, provide the cushions and so forth that the physician may have ordered so that they don't wind up with skin breakdown. And then here's a side view of the different pressure points. So be aware of those things. Inflammation is something that we have to watch out for any patient, but again, the elderly are more prone to getting infections. So whenever we see an inflammation at the site of a skin tear or just in general, like we see here, this left foot is swollen and inflamed as opposed to the right foot. We want to make sure that we continue to assess that. It's a normal process when there's a skin tear or something going on, an invasive process, but we certainly don't want it to end up in an infectious process. And you should be aware of the 5 cardinal signs of inflammation, which is pain, which we would assess by asking the patient, swelling, redness, heat or warmth when you touch with the back of your hand, which we'll talk about in class, and impaired body function, which makes the person less likely to be able to move that area of the body. Cellulitis is an infection of the skin. The chief symptom is inflammation. So how do you know by looking at it whether or not it's infected? Well, you don't necessarily know, but we certainly would report that to the physician. If we see inflammation, we would want to have him or her assess it to make sure that it doesn't turn into a cellulitis. So the chief symptom would be inflammation. not always a fever, and not always elevated white blood cells, especially early on. The first picture is mild cellulitis, perhaps from a bug bite. Again, younger people can sometimes, get away with a little cellulitis without an antibiotic. Elderly people, it can turn into a life-threatening situation. So we want to make sure that we are assessing for that. This is an example of severe cellulitis, which certainly would need to be taken care of with an antibiotic. Pitting edema is something else that we assess for. Edema means swelling. Pitting is the degree to which the skin remains indented. And what we want to do when we're looking for this is assess the level of swelling. And pitting edema can be caused by many different things. Not necessarily just a skin issue, but can indicate cardiac or respiratory issues as well. So the way that we measure pitting edema is you actually have a little measuring device, a little tape measure. 2 millimeters is considered 1+, and you would just actually measure the depth of that indentation. 4 millimeters goes a little deeper, and that's considered 2+. 6 millimeters is 3+, and 8 millimeter is 4+. So that would be severe pitting edema. And we can assess that and compare to a previous assessment to see if it's getting better or if it's getting worse. We also assess the skin for something called cyanosis, which is a blue or purple discoloration of the skin or mucous membranes, and it's due to the tissue near the skin surface having low oxygen saturation. So what's happening is, for whatever reason, circulating oxygenated blood is not getting to all parts of the body, and this can certainly be an issue in people who have respiratory problems, people who are dying, but it gives us an idea of the oxygen saturation of the individual. This is an example of somebody who has cyanosis of the fingers. That's what it would look like. This baby is obviously cyanotic. You can see all the way through his head, even in his trunk area. But look particularly around his mouth. You can see a lot of cyanosis there. This person has blue nail beds, indicating an oxygenation issue. This individual, you can see it in his or her toes. This person I put here because you can assess mucous membranes as well. Somebody who has dark skin, where you can't assess the bluish tone because their skin is so dark that you can't tell, the mucous membranes should be assessed. Many times dark-skinned people, if they're cyanotic, they're going to take on a grayish green look rather than blue. So keep that in mind. But if you ever want to assess for cyanosis and you cannot tell by the skin, assess the mucous membranes, because you can see right there she's got that bluish color to her tongue. Another important skin assessment is assessing moles. And what we're looking for with this ABCDE mole assessment is melanoma. Because that is the most deadliest of all the cancers, all skin cancers, I should say. We certainly assess for squamous cell and the basal cell, and they need to be taken care of, but melanoma is the most deadly. So the A stands for asymmetry. One half is unlike the other half. So if you look at this mole and you split it in half, you can see that it's asymmetrical. We also look for the border, which is B. When it has that jagged edge or scalloped edge or poorly defined, that's a concern. C stands for color, and what we're looking for is color variation. It has different shades of tan, brown, or black, and sometimes can be white, red, or blue, and you can clearly see there's variation in color within this mole. D stands for diameter. Melanomas are usually greater than 6 millimeters, not always, but usually. So anytime we see something that's bigger than the size of a pencil eraser, like they're showing here, then that's something that we would be concerned about. And the E stands for evolution. Now, we would have to have a baseline assessment to see if a mole is evolving, but if a patient presents with a mole this size, the next time you see it, it's this size, we want to worry about it. Even if it's not at that 6 millimeter, it's still changed. So you need to know this, the ABCDE mole assessment for melanoma. Skin turgor is another skin assessment that we use frequently, and that assesses the degree of fluid loss or dehydration. So what we usually do is we take an area of skin right below the clavicle, and we will do this in class, and if we pinch it very gently and it stays tented, that's an indication of dehydration. If it springs right back into place, then the person is not dehydrated, which I would expect we would not see dehydration in the student population, but certainly you will in the elderly population, especially when you get out into clinical. The Braden scale is used to assess the patient's level of risk for developing pressure ulcers. So I want you to understand that this is not something that we use to diagnose. It is something that we use to determine if somebody is at risk for skin breakdown. If we determine that somebody is at risk, we can implement measures to prevent it from happening. So it is a risk assessment tool. We use the tool to assess sensory perception. What is their ability to respond to pressure-related discomfort? Are they able to move, respond? Do they feel that they're having problems? If they can't feel the pain, they can't act on it. Moisture. How much is the skin exposed to moisture? Is the person incontinent and laying in a wet bed or a TENS or wet pants? Activity. Degree of physical activity. How much are they up walking around? Mobility. Are they able to change and control body position? If somebody's immobile in a wheelchair, they're less likely to be able to move to change positions. If somebody is comatose, they're not going to be able to turn to change position and get off that pressure, those pressure points that we talked about earlier. Nutrition, certainly at risk for skin breakdown if somebody's malnourished, so we take that into consideration. Friction and tear, are they able to lift themselves up to move? Or are they sliding across the bed? Puts them at a higher risk for skin tears. So just to give you an idea of what the Braden scale looks like, you can pull that up on the internet if you want to, but I'm going to show you right here. This is the actual tool that would be used. You can see over here it talks about sensory perception, their ability to respond meaningfully to pressure-related discomfort. The first one, completely limited, they're unresponsive. They don't moan, flinch, or grasp to stop the pain, okay? Very limited, they respond only to painful stimuli. Slightly limited, they respond to verbal commands, but they can't always communicate discomfort. Or no impairment, they're perfectly fine and can verbalize that they're uncomfortable. And then it goes down from there. So you can take a minute to look at that and read more about the Braden scale. We are certainly going to use it for some case studies in class. We're now moving on to the hair. This slide just shows you some hair abnormals that we would be looking for. You can see here that this is an infestation. This is what we would consider seborrhea dermatitis, where it's dandruff. You would know it as dandruff. It's flaking, and it's from the skin. It's from a dermatitis of the skin. This is a dermatitis underneath the hairline that we would pay attention to, certainly. And you can see here that the scalp is red and there's an obvious infestation of the hair. So when we're assessing the hair, and this comes right from your skills book, page 33, we would inspect for the evenness of growth on the scalp. Does the person have just plain male pattern baldness, which can be normal, or are there patches of what we call alopecia, which is unexpected areas of baldness? We would inspect for the thickness or thinness. Again, it could let us know if somebody is malnourished or even has a thyroid disorder. Inspect for texture and oiliness. We would check for infestations like lice, and also inspect the amount and location of body hair. So these are just some pictures of some nail abnormals. Much of this is indicative of nutritional deficiencies. I'm not going to hold you to what specifically they are. But in this one, you can see that there are some ridges, so that's a textural issue. This is indicative of a vitamin deficiency. So these are some things that you might see when you're assessing nails. The other thing that you need to look for when you're assessing the nails is what we call clubbing. This is not a nail issue in and of itself. It's indicative of a respiratory or cardiac problem, and it has to do with perfusion. So if you look here, the normal angle of the nail bed kind of goes like a convex type of thing. And then you look here, it's rounded, distorted. So this is really indicative of what clubbed fingers look like. Now that you know about it, you're going to see all kinds of people with clubbed fingers, and you'll know they have a cardiac or respiratory issue. This picture down here is a really good example of clubbing. It's almost like a balloon-like look to their fingers and toes. Capillary refill, or the Blanch test, is another test that we do on fingernails, and that lets us know about perfusion. So what you do is you press 2 or more nails, I like to do just one at a time, between your thumb and your index finger. You look for blanching, that white, where it turns white, and then you look for the return of the pink color to the nail bed. Count in seconds the time that it took for the color to return, and normal would be less than 2 seconds. So again, we're going to do this in class. And abnormal is indicative of poor perfusion, that oxygenated blood is not getting to where it needs to go. This concludes the theory portion of the skin, hair, and nails assessment. We are going to do demonstration and practice skills in class, but again, you need to make sure that you are well versed on the theory portion so that you can then apply it, and I will see you in class.